knee joint has this cartilage, the blue surface which you see, which is very smooth. This allows for free and smooth movement of the knee. In arthritis, what happens is this cartilage becomes rough, and because it is rough, there is a lot of friction, and friction causes pain. So in knee replacement, what we do is we take out all this bad cartilage. The bad cartilage is taken out with a saw, and in that place we put this artificial surface cap on the femur, another surface on the tibia, and both of these articulate like this, and this allows for free, frictionless and painless movement. This is basically knee replacement, where we replace the cartilage. So ideal candidate for knee replacement is a painful knee where the patient cannot even walk around in his home and the patient is otherwise generally fit. See, TKR started about 35 years back. That time the techniques were not that advanced, but now with the latest techniques, it is very safe to do a knee replacement surgery. And the patient is up and about on the very second day and can be discharged on the third or fourth day. Knee replacement surgery, the number one advantage which I would think is freedom and independence. With the pain relief and the increased mobility, the patient becomes independent. So a 60-70-year-old person used to previously depend on the relatives to go around. Now he becomes independent. He can take public transport. He can go wherever he wants. Two main concerns about knee replacement. Number one, pain, and number two is stiffness, and they feel they might be bedridden. So I give them the contacts of my other patients who have done extremely well, and they have no pain and there is no stiffness, and the patient walks on the very second day. So knee replacement surgery, like any science, is an evolving science. So what we were doing 10 years back, we no longer do it now. We are doing the cutting edge in knee replacement surgery at the moment. New recent advances which have come are unicompartmental knee replacement, computer-assisted knee replacement, and robotic. So unicompartmental is where we replace only part of the knee. If only one part of the knee is damaged, we do only partial knee replacement. Number two is computer-assisted knee replacement. In this, what we do is we use computer to help us to take precise cuts. And the latest what we are doing is robotic knee replacement, which is very precise, and we get precise cuts and the exact fit of the implants, and the patients walk very well on the very second day. So that gives the best possible outcomes. On this World Arthritis Day, I would urge all my patients suffering from knee pain not to live with the pain and to choose pain-free life with the latest in knee surgery.